thank you so much for coming. Really, I know that this is the first time we do it at Smith School, I believe, right? I'm not the first speaker, but this series, right, is really one of the first that. So I feel very excited about this. The reason you probably know that our school is, I think, just we want to rank number 2 worldwide in the intellectual capital. That is our research. We have a lot of great researchers in this school. And I know that one of the reasons you guys come over to the Smith School is because of the cutting edge knowledge and stuff. So I really, really appreciate this opportunity to talk to you about myself. It's like a bragging about myself. And I get food, right, by bragging myself. So I feel very good. Thank you, Victor. So this is where, thank you for coming over, and to listen to me. Feel free to stop me anytime. And if there's anything like unclear or you have a question, feel free to stop me, really. We will make it very conversational, very casual. And I know quite a few people here. Therefore, you should feel like, we are old friends. So feel free to interrupt me. My name is Gordon Gao. Then let me first of all give you my big ego slide. Okay, so since this is my background, a little bit of me, but I had electrical engineering and economics undergrad. I think it's not uncommon, right? These days we have 2 majors. Then did my MBA from a joint program for Tsinghua University and MIT Sloan. I worked for Compaq for a while, which is quite unique because not many people get a chance to work for Compaq. The reason that this company doesn't exist anymore. So it was actually bought by one of our famous alumna, and her name is Carly Fiorina. She used to be the head of Hewlett Packard, HP, famous for the printer and the laptops. Then she was heading HP, and then she bought Compaq. I was working at Compaq at that time, therefore the 2 companies merged and became the new HP, therefore Compaq doesn't exist anymore. I'm proud that I worked there for a while because Compaq used to be the world's biggest computer company. Then later on was taken over by Dell. Dell, Dell, right? So the first laptop computer was actually made by Compaq. So anyway, then I came over to Philadelphia, did my PhD in information systems and economics. And then I joined Maryland the year I graduated. It's been 16 years. I enjoy every day here, really, because, great people. And so if you look at my research, then it's mostly about IT's impact on firms and economy, especially in healthcare. So feel free to check more about my link here. It's about my homepage. And that's how I look like when I joined Smith School. And this is how I look like now, right? So a lot of gray hair, a lot of wrinkles on the skin. But I can tell you that I become wiser after I joined Smith School because I'm surrounded by great people, including colleagues, including students. They make me learn every day. So I really look forward to...
It keeps you younger.
Younger as well, yeah, your spirit, yes. Yeah. So I told you that my research is focusing on health IT application in healthcare. And I wear another hat, which is I'm the co-director of the Center for Health Information and Decision Systems, or in short, you can call it CHIDS, C-H-I-D-S, CHIDS. So what we do is we try to apply technology, algorithms to improve healthcare. And I will introduce to you a few of the studies that we do at my center. We also have an annual conference called Cheetah, speed, stuff like that. It's actually not easy to come up with an acronym that sounds good. So we tried several. Anyway, conference on health IT and analytics. So this one has this nice background in Washington, D.C. That's why I use it. But we do it every year. And our next year will be March, and again in Washington, D.C. So will be in the spring because of the COVID disruption. And again, if you want to learn more about that, email me, let me know. I will give you a discount code that you cannot share with others, okay? Because that code is the same, actually. Anyone get that code can get like a discount. So you can be a volunteer, then come over to learn more about what people talk about. So basically, in this conference, we gather people from all the leading institutes. For example, we have people from Harvard, Hopkins, Carnegie Mellon, Minnesota, Michigan. So all the people come over, sharing their latest research on how IT and analytics can be used to improve healthcare. So it's a good conference. And now let me tell you why I do healthcare and why it's hard about healthcare. So this is some data. It's about the venture capital's investment in the in healthcare AI. In particular, right nowadays, right, everything is called AI as long as it's related to analytics. Then you can see, right, the trend is going very strong, which means that they're pouring more money to it. And so if you look at like the job market, how AI is changing the job market, I would say healthcare looks very healthy. We are all worried about, hey, AI is going to take over my job, especially those in accounting. How many of you are majored in accounting? Okay, I know. Let me tell you, don't worry. Okay, I heard about AI replacing accountants maybe 5 years ago, and nothing has happened yet. And however, let me tell you, they are. Actually, it's within Deloitte, within KPMG, they are developing algorithms trying to automate the auditing process. The reason is that it's just too labor intensive. If someone else can do twice as much as work, right, than you, then basically your company will be put at a disadvantage because you are billing your clients based on hours, right? So this is why they're all developing tools, but those tools will help you rather than replacing you. So you shouldn't worry about it. And people just tend to exaggerate, like, oh, AI is taking over my job. So most likely, AI is going to augment your job rather than taking away your job. But then look at healthcare. You can see, right, there are large jobs created because of AI, because of technology. So this is where you definitely want to, this is why I'm passionate about healthcare every day. And this is where you probably want to take a more serious look at whether there are jobs in healthcare that you want to invest in. Okay, so this is data from PwC. Then here is like about automation. 40% tasks in healthcare will be automated. 33 will be, healthcare practitioners. And so this one is about support, more like administrators, secretaries, front desk. And this is about healthcare practitioners. And then there's 91% of healthcare execs saying that they are trying to hire people talented in AI. And we see this actually in another survey. Here's another survey. It's about doctors. This is done by American Medical Association. You probably don't know AMA. It's very powerful. This is a very powerful organization. It kind of represents all the physicians in this nation. And I won't say much about that, but check it out. AMA is very powerful. And so they did a survey about the doctors using AI. And what you can see is that this is like the percent, right? How many of already using AI in different functions, like using AI for health administration, using AI for clinical application, or for personalized medicine, right? Clearly, the ratio is pretty low, right? They are not using AI a lot yet, but they have great interest. You can see 36%, oh, I'm going to do it next year. Again, don't believe in them, okay? Just like your New Year resolution. How many of you really fulfilled your New Year resolution? But at least it shows that your interest, right? They are very interested in AI. So that's 36%, I'm going to do it in 1 year. And another 27%, I'm going to do it in 2 to 3 years. Even though they were not able to make it happen, because of lack of talent, because there are not many people knows both technology, especially AI, and healthcare. So it's very hard to recruit good people. But still, at least you see the demand is there. It's huge. And so So this actually got us up and going every day. And then here at Smith School, we're training business leaders. Then as a leader, what do you need to do? You're not going to do coding very much because your time should be spent on leading, right? You need to know coding so that you can lead a team, but your job is not doing coding every day because we all have 24 hours every day, right? Your bandwidth needs to spend on more important organizational, managerial, mission, right, critical tasks. So this is where you need to know AI so that you can be an effective leader. And here is about how to prioritize AI projects, how to create a culture of AI in your organization, how to manage the risks, how to upskill your colleagues so that they are on the same page as you are, how to optimize the workflow because AI is going to get in and replace some of the jobs, okay, some of the tasks, not the jobs, and then how to be a visionary leader, right? So all this actually give us new challenges. And this is why at my center, we are creating cutting-edge knowledge to try to equip our leaders with this kind of knowledge. So, okay, so far that's the bragging part. I don't know whether you have any questions, anything you want to discuss. Before I jump into several examples that we do in my center about how AI is helping healthcare. So we work with extensive network of companies and then use their data and deliver AI solutions for their business challenges. I will show you a few. And I will also show you things that I see are upcoming that are still very, very big trends and hopefully get you excited about that. And so you can write an email to me saying, hey, I want to be a researcher in your center, so where there is opportunity, I will be able to connect you with the right person. So sounds good? Okay, so then let me just go through a few examples. I don't know how long Victor allows me to talk. How long
We're done at 6.
It's 6 o'clock. Okay, I still have enough time. Okay, cool. Feel free to eat. Okay, so I don't want you to just starve. So this is one that we worked with a company. Actually, this company was founded by our alumnus. So here. So this company is online coaching. This is a coach. This is the patient. So you know that we have patients who have difficulty managing their conditions. They need help. And because of COVID, right, so in the past year, we cannot do this kind of face-to-face help. So online coaching turns out to be a viable solution to help, right, connecting the coach with the patient. And then, so say a patient has diabetes, right? And then you cannot, so then the coach can talk to the patient every 2 weeks about, hey, how's your condition going? Exercise, diet, medication, sleep, right? How are things going? And try to encourage a healthy lifestyle. There's some misconception, by the way, about diabetes, saying, hey, you have diabetic, you must not be very responsible for your eating or exercise. Those are wrong, okay? Those are social stigma associated with diabetes. Actually, healthy behavior definitely will help diabetes condition, but let's not blame people, right? Getting diabetes is because you didn't manage yourself well. Okay, so it's very complex medical condition. And so the science is still very underdeveloped in this field. Why people become diabetic? Even people who are very slim, who exercise very often, they suddenly become diabetic. Science is still not very developed in this field. So again, I just want to, every time I have this opportunity, I want to clarify that don't judge the patient saying, hey, you need to improve, okay? But still, right, we want to help them. And then this is where how you adjust your medication, how you adjust your diet so that you don't have hypoglycemia, and you don't have hyperglycemia either, right? So these are two extremes of your blood sugar level. You want to keep it stable.
Can I ask you for clarification?
Please.
So you said, because I found that interesting, because I just learned that I do have a little borderline. So are you saying that even the most healthiest person has the potential to get it as well? So
yeah.
certainly we need to do what we need to do, but the science still has not caught up with the reason why
Yeah.
diabetes has come to
Right.
fruition.
Yeah. I forgot who that guy is, but I remember that he is a Olympic level athlete. And he's very lean, very strong. And then suddenly one morning, he woke up and felt not feeling good. Go to the diagnosis, he's diabetic. I remember that he talked about his own experience. There's no reason for me to be diabetic, but you are. Yeah, so yeah, it's very complex. And so then the issue is that how we can make the coach talk to the patient more effectively to help them, right? So oh, I think you are taking medication, right? You should take medication more regularly to regulate, right, the insulin and then the blood sugar level. So things like that. So help the patients, right, so to do things better. And in the past, you want to manage, right? You want to see, okay, how the coach is doing. You as a business manager, you have dozens of coaches here. And you have, right, managing hundreds of maybe thousands of patients. Then you want to give advice to the coach. Hey, what can you do, right, to help the patients better, to be more effective in this communication? So how can you manage that? That's a famous saying in management. Saying, if you cannot measure it, you cannot manage it, right? You cannot, if you don't know how things are going during that half-hour session, then you cannot tell the coach what you can do to improve. So this is where, before our solution, this online coaching session was like a black box that we don't know what's going on. And as a manager, you just cannot actually observe, right, join and observe. So what we did is we actually, using AI, we are able to decipher their emotions. There are 7 emotions, and like a fear, like a happy, joyful, like a disgusting, like a neutral, which means I'm bored. And so there are kind of 7. And then we are able to decipher the emotion in near real time. And then you can see, right, this is displayed here. That's the probability of the expression, in these 7 emotions. And then after the session is over, the coach will get a report about, how things are going. And what's more, we're going to link this data with the patient's behavior next week. Is this talk effective or not? And then we got some very interesting insight. Normally, we would think that if the coach has a very good relationship with the patient, and they are laughing together, they have great bond with each other, then the patient would do better, right? And turns out in our analysis, we found a little bit different. The coach's expression of fear is associated with increased adherence of the patient. So I guess what's going on is that the coach sometimes need to be telling the patient, the condition, right, is deteriorating, and we cannot let it go like this. Otherwise, right, so you might risk losing your leg, right, because of infection, whatever. So this kind of fear emotion turns out to be very effective. So then one suggestion would be for the coach, right, to some patients, you want to be clear about the risk. Don't just try to have a great session. We all enjoyed it, everyone is laughing, but in the end, the patient didn't change or didn't realize the risk, which is bad for the patients. So sometimes you do need to show the fear emotion. That is, if you go like that, that will be some terrible things might happen. Make sense? So that's what we had. And we also found that the patient's emotions were not significantly predictor of adherence. So in some way, keeping the patients happy clearly is good, right? Nothing wrong with that, but that's not critical to the patient's adherence behavior. Adherence means you stick to the right thing to do, like taking medicine in the regular basis. So that's one. Without AI, we're not able to get these insights because we cannot measure what's going on. So just give you one example. And we actually implemented this on Amazon Web Services for a 30-minute video, and then we'll be able to process, then get all the emotions deciphered. Do you know how much it cost? Can you give me a guess? How much is the computing cost? How much AWS charges us to do this? It's about 7 cents. 7 cents. It's really, really affordable, and can do it very, very efficiently. Within a few seconds, we get this done. So computing has improved a lot. Okay, so that's one. That's about computer vision part. Now, whatever you see, you're able to encode it using AI, which is really powerful, right? So a lot of visual signals that we cannot process before, now we have the tool to do that. So now second part is hearing or language part that AI is showing its strong power. So I want to give you this example, which is called hierarchical condition categories coding, HCC coding. Let me explain what this is. So basically, this is used by the Centers for Medicare and Medicaid Services, called CMS, which is not far away from here, right? You know CMS, right? It's closer to Baltimore. And okay, see, how many of you know about CMS? You don't know, that's fine, because if you're over 65 years old, you definitely know it. The reason is that, you know, right, we cover patients or people who are over 65 years old. They are covered, right? The insurance is covered. And who provides the insurance? It's CMS. CMS is a government-run health plan for people over 65 years old. And so then the CMS, right, covers the patients. They need to pay the doctors if a patient needs a surgery, say knee replacement, right? Which is a common surgery these days. Like your knee, right, has wear out because you run a lot of marathon. By the way, there's no scientific proof that running a marathon will wear out your knee, okay? But let's say it that way. So anyway, so you need to replace your knee and you're over 65 years old. Then the CMS will cover that. And the doctor will do that. Then CMS needs to pay the doctor. The question is, how much should you pay the doctor? If you are a patient who is otherwise healthy, only has a knee problem, and just replace the knee, then that's one scenario. Another scenario is the patient is also diabetic and has a heart problem. You know, then this knee surgery probably will be higher risk, right? You need to manage a lot of things. You want to make sure there's no bad things happening during the surgery. So this is where the complication will be different. And all these are called conditions. That is, you want to know the patient's condition so that you can decide what is the right thing, the right amount to pay the doctor. If a doctor is working on a very complex patient versus a simple case, then they should be paid differently. That's why when the doctor tries to submit their reimbursement to CMS, this kind of a condition is very critical because that determines how much money they get paid. And so I'm showing you a few kind of this kind of condition coding, and you can see, right, so how much money associated with those. If the patient is identified with this kind of a condition, then right, how much money is associated with that. So the issue is that many times the condition is not well captured in the structured data, but rather they're just written by doctors in natural language. So our job really is to try to encode those conditions through the doctor's clinical notes, which is very messy, to say the least. It's much better. In the past, the doctors just write down things, and the handwritten notes are almost illegible, right? So it's very hard to read. But nowadays, right, they type on the computers, but still, the information there needs to be marked out by human. So we work with a company who has over 600 coders there, read through the documents and try to circle, hey, this is one condition, and then code it like HCC 88. And our job is to see whether we are able to use AI to automate this process and to help the coders do a better job. So that's what we did. Now here is a clinical note. And then we're going to process this clinical note and identify the hidden conditions that are written by the doctors, like here. You have COPD, here you have arthritis. So that's what we try to do. And to do that, we actually use a deep learning-based vectorization, which I want to go into detail. But let me tell you that it's pretty amazing. So basically, you are able to turn all the words into vectors. And then you're able to do a lot of computation based on these vectors. So I won't bother with more tech details into it, but just let you know that we're very proud of this research. And so let me just give you an example here. Like age, you can see age here, right? Age from 0 to all the way, maybe 120 years old. You know, age is age. 58 to 59 is a 1 year difference, right? Mathematically, it's a 1 unit increase, 58 to 59. How about 64 to 65? If you just want to analyze the data, okay, someone is 64 years old, now this is 65 years old, it's a 1 year difference. It's the same as 58 years old to 59 years old. However, now you know there is actually a huge difference, because once you jump from 64 years old to 65 years old, you are now covered by CMS. Your insurance changed. You have a different health plan. And therefore, the patient's behavior, including their expenditure, changed dramatically from 64 to 65. That makes sense? This is why if you want to just represent age just using the numbers, use the numeric value, you are missing a lot. It's not only just a 1 year difference, 1 year older. It's actually a huge change in the financial condition, in the health plan, in the expenditure. All these things change. So this is why actually we did our vectorization. We're not using just a number to represent age, but rather we use a vector. You know, a vector, right? It's n-dimensional. So we just depict those vectors here. You can see actually here age 18, 19, whatever, right? These are very closely linked to each other. But age 64 to 65, you see this huge gap. That actually indicates that our vectorization was able to capture the huge difference between 64 years old and 65 years old. That means the vector actually has very rich information. In some way, it's like a black and white picture versus a color picture. You know, color picture has 3 channels, right? RGB, right? Red, green, and blue. And if you have a black and white or a gray, then you have 1 channel. So because basically we're representing the age using multiple channels, therefore the information is much richer. I hope I convince you. So then once we have this rich information, then we could apply it back to our original task of identifying patients with different conditions. Now it's based on not only the age, okay, each word now has its n-dimensional vector. Therefore, it's much more precise to identify them than just using a plain text. The reason with plain text is that there are too many false positive. False positive, that is, right? You can do a keyword search, but many times arthritis is not because of the patient. Maybe it says, my dad has arthritis, but I don't. You got it? So therefore, it's a false positive, right? It's not, the patient doesn't have arthritis. It's the family members. So this is why you need to use a lot more sophisticated mechanism to identify the right condition for the patient. So by turning these words into vectors, just like this one, help us improve the precision. And so we actually also use this to do the prediction of readmission. That is about whether the patient after surgery will be readmitted to the hospital in 30 days. And then our method actually beat Google's method in the performance. So we are very proud of this. And this is a CMS method, which is kind of even lower. Okay, so that's the second one about natural language. So now let me talk to you about the third major category that I'm super excited about. That's the big data. So big data, very old term. Everyone knows big data, right? So everyone is tired of big data. So why do I sell big data to you guys tonight? So the reason is that I don't think we leverage big data to its full potential in the healthcare. So we all know, right? So big data is coming out a lot, right? So because of the social media, like LinkedIn and Facebook and YouTube, and also because of mobile devices, right? So anyway, I will skip this kind of online review thing. You all read reviews, right, on Amazon.com or like movie reviews, right? So which website do you guys use for movie reviews? Or you don't? Rotten, okay. So, or you just use the friends, right? So recommendation, whatever. So then the online reviews come out. So it turns out that these online reviews become the most dominant channel for patients to choose doctors. Imagine, right? You have a condition, and you want to see a doctor, say ear, like an ENT doctor. Then you can search College Park ENT doctor. Then there's a list of doctors show up. Who do you pick to go to? You might go to, hey, I want to let my family doctor decide. Sometimes your family doctor just give you the list as well. Then you decide, right? They give you the list. Here are 5 doctors, you choose one. Who do you pick? I guess you will go to the internet, search for that doctor, and see what others say about this doctor. That's exactly what I did. And then the issue is this kind of online reviews, they are written by anonymous patients. I'm not saying they're fake. Some of them are fake, actually. But at least, right, they are not very scientifically collected. They are not a representative, right? So this is why I talked to you about AMA, American Medical Association. AMA said, don't trust these online reviews. They are junk. They're just the disgruntled patients, venting their anger towards their doctors. So AMA says that just don't use these online reviews. But on the other hand, you see this, The Economist, this is another journal, said that patients are starting to give doctors a piece of their mind. The result should be better care. So results should be better care, right? So why? Because economists believe that if there's more quality information, then patients will be able to choose good doctors and shy away from bad doctors, right? So therefore, it should be better care. Good doctors will get more business. Bad doctors will be driven out of market. That's a typical economics thinking. So in reality really does it work? Do online reviews really help patients choose better doctors or not? That's the problem that we're facing. And this is a big data problem because we have millions and millions of reviews. And we actually did a series of studies about doctor reviews online. Do they reflect the doctor's quality? The answer is yes and no. Yes, in the sense that they reflect the quality of bedside manner. No, in the sense that they don't reflect doctor's clinical quality. So if you want to choose a doctor that is nice, online reviews will be a good resource. If you want to find doctors who will not kill you, then you probably should look for something else. The online reviews won't tell you the clinical quality of the doctor. Make sense? And so that's our finding. And we also look at how these online reviews affect the patient decision making in choosing doctors and so on and so forth. I have some research papers there, so I won't get into detail. Okay, that's one big data source that is patients contribute to social media about their opinions. So another big data source is all these gadgets. I know that we'll have them, right? Fitbit, and even our phones, right? Will capture what we do. Everyone is carrying a phone, right? This is what a picture I took in San Francisco subway. So a few years ago, you can see there are 5 phones. 1, 2, 3, 4, 5. Even there are 4 people or 5 people here. So there's another one. And this is when I travel in China, everyone is looking at their phone. So basically, and a lot of mobile apps. If you look at Apple, that was last year, right? This year's Apple Watch, I don't know what they talk about. But last year, Apple Watch, everything is about health, like future of health is on wrist, right? Measure your heartbeat, measure the oxygen level, measure your breathe. My Apple Watch keeps telling me, you need to breathe, you need to breathe. I don't know why, so I guess I didn't breathe. So anyway, so basically, the point I want to make is that now we have a lot of data which are not available before, including like your body temperature fluctuation, right? So we'll come back visit that later. But first of all, let's talk to this device, a new device that I'm very passionate about. It's called CGM, Continuous Glucose Monitoring. What's that? We eat, then then the carbon stuff, right? Carbohydrate, right, goes into your blood, and then glucose level began to go rise up, and then so basically you measure this up and down, which links a lot to whether you can focus, whether you can make the right decision, whether you are sober or not. Okay, so this is where the glucose monitoring is actually important, clearly important for patients with diabetes. But even for common people like us, I feel like it's still important. So this is my glucose level. I took one and put it on my arm. If you want to see how it looks like, that's me. Can you tell? Can you tell where it is? You can? Oh, really? You have good, very sharp vision. You have 20/20. Yeah. So it's here. It's really like now very, very tiny. It's like a big coin. You can attach it here, and then it sticks with me for 14 days. That's a lifespan of this device. 14 days. I even forgot it was there, really. So it doesn't hurt. You do not feel it most of the time. And it gives me all these measures, which is very precious because it tells me I shouldn't eat too many dumplings. If I eat like over 7 dumplings, this will be like my blood sugar level will go about 130, which is regarded as like being unhealthy. And so I learned quite a bit about how my body responds to different kind of food. Like I can eat a pizza without any problem. I can eat a whole pizza, and still my blood sugar level won't have a spike. But I cannot eat a lot of like what's that? So angel hair, those kind of Italian stuff, and that actually tends to give me a big spike in my blood sugar level. So I learned quite a bit about myself. And then what I want to say is that now these kind of devices will soon be available to everyone. And then there's a huge amount of data being available to you and to the doctors. So how can we leverage this big data opportunity to improve our care, to make people live a healthy and a happy life? That's a big challenge that we're facing now. And okay, I'll skip. So this example, 37, I know, we should have used this 37, sorry about that. I should have used 98 or 99. What's that? It's a magical number. It's your body temperature in Celsius, right? So in the Fahrenheit, it's 98, I guess, 98 to 99. And so turns out this is meaningless because everyone is different. And even this number, which originally came from Europe, they use Celsius system, therefore I put 37 there. It's a Austrian doctor who needs to know, hey, what's the standard, right? The patient has fever, doesn't have fever. What's the standard for normal temperature? So he collected data about 100 patients and averaged them. Then he got this number 37. And then now the whole world is using that for decades. Turns out this number, our body temperature actually changed a lot. You know, in the early morning, your body temperature will be almost like a one degree lower. And then in the like a 5 o'clock afternoon, like at this time, your body temperature actually rises a lot. And also, people are different. Men, women, they're all different. Kids tend to have higher temperature, body temperature. So whether you are having fever or not, it's not like, oh, your body temperature is over 101. But rather, you should compare with your baseline. Compared to the past 1 year, at this time point of the day, how your body temperature is on average. And now you are 2 degrees higher, therefore you have fever. Make sense? So that will be a much more accurate and a much more personalized measure of whether people have fever or not. I remember that very well. It was one of the scariest moments of my life. I have my daughter who was about 1 year old, I think. So then she had several flu shots. You know, those days, right, we were very aggressive, right? We gave 3 shots at the same time. I remember that one nurse, the other nurse holding her, and then they put 2 needles at the same time. So anyway, so it was very scary. But anyway, so the doctor told me that, okay, your baby will have fever, which is expected with a reaction to the vaccination. And so when the body temperature goes above 101, give her this kind of medication, like, you know, to drive down the, you know, the fever. And so I did that, and I measured the temperature, and then look at, okay, it's over 101, not yet, over 101, not yet. And then it's over 101, then actually I began to administrate the oral medicine. What's that? I forgot it. It's like a very typical thing, maybe like ibuprofen, so like those. And but then she began to have seizure. It was very scary, you know, like her eyes began to roll up and her body became very stiffy. In my arms, really, I was so scared. I really don't know what to do because I cannot put the medicine anymore, right? So fortunately, right, in 2 or 3 minutes, she recovered from that. But that's really, at that time, I feel so like helpless. I don't know what to do. Should I call 911? And so will this go away? Really, so I don't know what to do, even as a healthcare researcher. Just to let you know. That's exactly right where, you know, this kind of threshold, everyone follow that threshold. That's why it is not the right thing to do, right? Suppose right, we have my daughter's body temperature measured, and we know that actually there's a significant increase, and it's also going up. The trend is going up. Then I probably could administrate the medicine, say, 20 minutes earlier. Then she won't have this seizure, right? So that's actually one of the things that's why I feel like even body temperature, we don't know, we are not having the right measure, which is really, really terrible, right? So this is where big data could help us, right? By wearing all these devices, then you know your body temperature, and you know when you should take medicine, right, ahead of time. Okay, so I still believe that big data can do a lot. There are terrible stories about babies, right, didn't get enough water, and unfortunately died. And so, and the reason was that, you know, we didn't measure how much the baby is drinking, how much water the baby is drinking. So the baby is admitted to the hospital, and then the nurse said, you know, baby is doing surgery, therefore no water today. But they forgot to take off that order. It turns out no water today, no water today, no water today for several days. Then finally, you know, baby died. So just these terrible things happen, and we hope that big data, if we monitor the body fluid, then that could solve that problem, right? Prevent that problem from happening. And yeah, like put sensors in the diapers, right? If you're not having enough, you're not wetting the diapers, something wrong, right? So you're not taking enough water. So this could be easily done, but we're not doing that yet. So anyway, okay, I will skip all the others. So especially after dinner, I want to talk about this. But anyway, let me stop here. What I want to tell you is that technology is evolving. We're getting a lot of sensors, a lot of big data. And with the AI examples I talked to you, we can analyze the data in a very efficient way. And then with lots of big data coming, really life will be much better. And there are so many potentials in healthcare using IT. So pretty much that's.
Thank you, Gordon. Thank you so much for
Sure.
this. And this is our last session for this fall semester. And thank you so much for coming. That would you say that the theme of all of the sessions, for those of you who attended one or more, is that research has such a strong ability to predict possibilities, right? Justine and I was talking right before you came, and I think one of the sessions we want to do is with PhD students on how do they come up with their ideas. You know, what prompts you to want to sit down and say, what prompted you, Gordon, to even want to just study this? You know, listening to you, you could just see, okay, you're all excited about it, and I'm looking out here like, wow, you know, you're trying your best to be excited about it.
I know that two leaders were very excited just now, jumped off their seats.
What excites one to even come up with, you know, these hypotheses where if this goes up, what's the predictor of that? You know, just from a general perspective.
Yeah, I would say, you know, this really is an iterative process, and it takes a long time. So Justina is there, right, managing so many doctoral students. They have very bright ideas. And then as a faculty, my job every day is very much like what you are saying. That is, I will try to shoot down the idea, saying, hey, this idea is not workable. You cannot work on this idea because you cannot solve the problem. You don't want to boil the whole ocean, right? So then we need to have the combination of several things. Number one, is this problem intellectually exciting? That is, in the plain English, is it interesting? Clearly, interestingness is very subjective, right? I find this interesting, I do not find that interesting. Someone like hiking, someone like swimming, right? So yeah, it's a subjective, but still, there's a kind of a generally accepted sense in the academic community of what's interesting, right? If everyone said this is not interesting, then you have a problem. If someone said it's not interesting, but someone said it's interesting, then you have your audience. Make sense? So yeah, that's number one. That is how intellectually exciting it is. Number two is rigor. Because we're in the science community, so you don't want to just say, oh, this is interesting. Like rumors on the internet, right? They are interesting. There are not so many rumors, right? So about all kinds of things. And they are interesting, but they are not scientific. So to be scientific means it's true, right? And you can repeat that so that your discovery or your findings will be tested by others and it still holds. So to do that, then you really need to be very rigorous in your research process. Like you need to have the right data set, you need to have the right methods, right? And then all these kind of different considerations in the research design. And if you don't have the right data, or you have a serious, we call it endogeneity problem, that is, you cannot identify the causality, then you probably do not want to work on it because you cannot say for sure. So that's the second one. And the third one is called impact. That is, will this research question create impact?
Change the world.
Change the world, yeah, with baby steps, yes. And if there's a question that only you are interested in, but it doesn't have a meaningful impact, then probably you don't want to work on it. So yeah, I would say, the three things combining together, that's where you have a good research question.
Gordon, when I wanted to change the world as a PhD student in 1 year, I remember going up to my advisor like, I don't want to do this. He goes, first you just need to pass your dissertation. And so why don't you just carve out a little piece? And if you want to change the world after that, you can do that.
Exactly, yeah. Most of the problem is that it's too ambitious and just too ambiguous. So we feel, hey, this is too small. I want to work on a much bigger problem. And turns out the big problem has so many moving parts that in the end you cannot see anything. You get it? So then you're wasting 2 or 3 years. In the end, you cannot see anything scientific. that's a terrible idea, right? So,
Any thoughts or questions you guys have before I let you go?
yeah, my email address, right, you can Google me, right? It will pop up. My email address is ggao@umd.edu, which is very easy to find, so feel free to reach me out. Anything.
Awesome.
Okay, thank you. Thank you for.
Thank you so much.
So nice.
Take care, everybody.